What is a seizure? A seizure is a transient occurrence of signs or symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. Now, seizures have to be distinguished from epilepsy. Epilepsy describes a condition in which the person has recurrent seizures due to a chronic underlying process. Now, let's look at the types of seizures. They are mainly of focal or generalized variety. Focal seizures originate within networks limited to one brain region. Focal seizures can be with intact awareness, where the person is awake and alert, for example, a Jacksonian march, a tingling or twisting that starts in one finger and slowly moves up the arm. In focal seizures with impaired awareness, the consciousness is altered. The person may have automatism like lip smacking, fumbling with objects, or aimless wandering around without awareness. Now, generalized seizures arise within and rapidly engage networks distributed across both cerebral hemispheres. They are of 6 main types. In typical absence seizures, it's like pressing a pause. A child suddenly stops, stares for a few seconds, and then snaps back to normal. In atypical absence seizure, there is the same pause but slower and longer, often seen in developmental disorders. Generalized tonic-clonic seizures are the classical seizures, where there is a sudden collapse, body stiffens, then jerks violently, and finally relaxes. In atonic seizure, there is a sudden loss of muscle tone, like a person may suddenly drop to the ground. In myoclonic seizure, there is a quick shock-like jerk, like suddenly dropping a spoon or flinging an arm. In epileptic spasm, seen in infants, there is brief, repeated flexing of the arm, neck, or legs, often seen in clusters. That's about seizures for today. Kindly subscribe and follow us for more updates.